Hi, this is Dr. Jennifer Neff, and I wanted to do a little video on how to talk to your doctor. Now, I've been working in a family medicine office for about 21 years, and I have seen a lot of patients, and it is my pleasure to do so. I love connecting with people, I love listening to their stories, and I love taking care of them when I can, or helping them take care of themselves. So, what I find is that there are many different ways that patients will approach their visit with the doctor. And if I could come up with a few things that I could suggest for you guys, that might make it a little bit easier for you, because sometimes being in the physician's office is a really nervous-making experience, and different people deal with it different ways. Now, I've got all this little, the left bubble that's coming above my head that nobody can actually see, but I'm thinking when I'm listening to things. And what I love to mention as something that I wish everybody would keep in mind talking to a doctor is when I say, so how long have these symptoms been going on? And then people look at me very earnestly and they say, well, a while. It's been going on a while. And I'll say to myself, how long is a while? And often I'll say that, how long is a while? And they'll say, at least since my aunt's wedding. And then we're really getting somewhere, because I know exactly how long a while is, which can be anywhere from 30 seconds to 3 years. And your aunt's wedding, I know exactly when your aunt's wedding was. So take it easy on your doc. It would be nice if you're trying to manage your thoughts, like when you're waiting in the waiting room, to sit down and say, okay, I've had nausea, abdominal cramping, and diarrhea. The nausea started 3 days ago. The diarrhea started 2 days ago. So even if you can just package it in a little kind of mental package for the doc, even that part of it, then they'll say, okay, so this is what we're dealing with. And then can start building on the story from there, because if I have to spend most of my time in the office pulling it out of you, then I don't know what the history is. And in the Western medicine world, the history is all of the facts and information that we need to help with the diagnosis for you. Now, I get many different types of approaches. And one time I said to this guy, I said, so where on your head does it hurt? Because he came in for headache. And he looked at me and he said, well, you're the doctor, you should know. And I'm thinking to myself, wow, I did not take my psychic, pill this morning. So no, he was angry. I get it. There's lots of different reasons for people to bring emotion into the room, and the emotion comes into the room with me and with the patient many times, and I can manage that. We can manage that. But no, your doctor doesn't know exactly where you're hurting. So if you can say, I've had a headache on the sides of my head for 5 days, and it doesn't go away ever, or it's there in the evenings, but it's not there when I wake up in the morning. The more details, the better. And if you're having some difficulty writing it down, then just write it down. The other thing is, sometimes with the electronic medical charts, as a doctor, I have to take my attention away from you in order to find out that you have, that you're on these medicines and have hypertension and that you've had these surgeries. And so it would be nice, but not mandatory. If you're feeling like this is a complicated thing and I want to be able to make it easy for the doctor to see things easily, you take a 8x11 sheet and you write down your medical diagnoses, which would be like hypertension or like diabetes or like headaches or like anxiety. You put a list of your medicines, you put a list of your surgeries, and then you just say, I just want to refresh your memory. I know it's in my chart, but here. And then the doctor can go, bam, got it. Okay, let's go. Let's rock and roll. So that part of giving information to a doctor is fantastic. So another thing that I want you to think about is that if there's something that's eating you up in the back of your brain, I want you to tell your doctor about that. I want you're in the office with me and say, Dr. Neff, the thing I'm most worried about is that my best friend just got diagnosed with breast cancer. Okay? I need to know that, because if I'm going through all of the things that I think it might be, but I'm not addressing your concern that it is or that it's not that, or looking for something that you're really worried about, then you're not going to leave the room feeling like you've been heard. And actually, the truth is, we can't hear you if you don't say it out loud. Okay, so if you're saying, my father had a heart attack and I'm really worried it's my heart, or if you're saying my mother has had her gallbladder out and my sister and my aunt and I'm really worried it's my gallbladder, we want to hear that. Okay, the other thing that is going to get you the best experience in an office visit with a doctor is come in and tell us about your symptoms. Symptoms mean things like runny nose, cough, fever, tired, difficulty breathing, chest pain. Those are symptoms. Diagnoses are sinusitis, bronchitis, stomach flu. Okay, so if you come in and you say, I have a stomach flu, then that means I think I have a stomach flu. And the doctor is still going to want to know all the different pieces of it, because not everything that acts like a stomach flu is a stomach flu. A stomach flu could be many other things, some life-threatening and some not. And so it's okay to say, I'm worried I might have this diagnosis, but you come in and you declare you have the diagnosis. Some doctors are going to be like, whoa, why are you even seeing a doctor? Which, don't get me started on that. But if you come in with the diagnosis lead forward, then what that does is that kind of limits it limits the creativity of the diagnosis. So you can say, this is what I'm worried about. And in fact, you do need to do that. Okay. Now, I hope I've given you a few things to think about when you're organizing your thoughts before you go and see your doctor, so that you can get the best and the most out of your experience. Take care. See you.